Okay, Gina, could you pull up your slides, please?
Yes.
And I'll just quickly introduce. Hi, everybody, and welcome to this workshop of the Virtual Pharmacy School Fair. My name is Gabriella, and I'm from AACP. I'll be moderating this session. We'll get started in a moment with exploring teaching pathways in pharmacy from preceptor to a professor. But first, a few housekeeping items. So although you will be muted the entirety of the webinar, please feel free to ask questions in the Q&A window throughout the webinar. And we'll try to save some time at the end to address those questions. And if there are any questions we don't get to, the speaker should be available during the expo hours, which are 5 to 7 p.m. Eastern time today. So we highly encourage you to visit their virtual booth at that time. Additionally, this presentation will be recorded and available immediately afterward in the Sessions tab. So now I will turn it over to our speakers to get started.
Thank you so much. Hi, everyone. My name is Gina Bellotti, and I am a faculty member at Thomas Jefferson University in Philadelphia, Pennsylvania. I'm also the Director of Admissions, Recruitment, and External Relations. And I'm here today with one of my colleagues. Let him introduce himself.
Thanks, Gina. I'm Dylan Zook. I'm also a faculty member here at Jefferson College of Pharmacy in Philadelphia, and I'm excited to talk to you guys today.
So we are here to talk to you today about our jobs, the career path that we chose after we graduated from pharmacy school and became licensed pharmacists, and that is teaching. So we, as we mentioned, are faculty members at Jefferson, and we want to talk to you today about what the different opportunities are within academic pharmacy for pharmacists. So we're going to talk about the three pillars of academic pharmacy. So these are the three areas that pharmacists that are working in academia cover. We're going to talk to you about the different roles and responsibilities of full-time faculty members, guest lecturers, and preceptors. We'll talk through the steps that you can take to enter academic pharmacy. And finally, what are some things that you can do to prepare for a career in pharmacy academia? So if you're thinking about a career in pharmacy, you have probably already identified that you like biology or chemistry, or that you want to help people, that you're interested in medicine and healthcare. But maybe there are a lot of other things that you're interested in. Maybe you have thought about teaching, maybe you've thought about going into research. And these are some of the things that you can actually combine if you go into academic pharmacy. So one of the things I think that we will both talk to you about is how we were really drawn to how many different options there are within academic pharmacy and all of the different pieces that we get to put together to create one career path for ourselves. So being in pharmacy academia definitely is a pathway that will open up a lot of different doors for you and really help you to be able to combine a lot of different interests into one job, which we both think is great. So within academic pharmacy, there are three main areas that faculty participate in. They are teaching, service, and scholarship. So under the teaching umbrella, these are going to be things like the actual instruction that's provided, whether that is doing a lecture or facilitating some sort of classroom activity. There is also course coordination, so being the faculty member who runs a course. In some instances, you may also then be teaching the whole course, or you may be working with other either guest lecturers or other faculty members to deliver that course. You, under the teaching umbrella, may also be involved in course development. So that is actually being able to create a course from scratch, or perhaps you take over a course and can think through all the different ways that you might want to improve it. So there are a lot of different facets to being involved in teaching beyond what you may have experienced as a student so far, which is usually just seeing someone come to class and provide that classroom instruction. Where this instruction takes place can vary. So it certainly can take place in a traditional classroom, but it also may be in a laboratory or for pharmacists that work in academia can actually be at your practice site. So we're going to talk to you about a unique area of academic pharmacy, which is experiential education. And that's the education that actually takes place where the pharmacist is working as a pharmacist. So that could be in a community pharmacy, for example, or in the hospital. And that is a very fun area of academic pharmacy where you actually get to have students come with you and learn all about what you're doing day in, day out as part of your role as a pharmacist in whatever site you're working in. Another pillar of academia is service. So this could be service into the college. It could be service to the university, to the profession as a whole. So participating in a professional organization, for example, and then community service as well. And then finally, scholarship. So scholarship includes research, taking that research and getting it published. So whether you are working on some kind of poster at a meeting or a manuscript that gets published in an academic journal, and then finally presentations. So what we're doing today, this is part of our scholarship, would be to be giving a workshop or a presentation. You may do that at a local meeting or a national meeting. So getting out there and sharing your expertise is all part of scholarship. So depending on your role, you may participate in all three of these areas, or maybe just one or two. And then the extent of your involvement in each one will vary depending on whether you are a full-time faculty member or an adjunct faculty member or a preceptor. So next I'll elaborate a little bit more on being a full-time faculty member. So a full-time faculty member is someone who is going to be employed by a college of pharmacy, and their Monday through Friday is primarily centered around things that need to be done to serve that college of pharmacy. So a full-time faculty member is going to engage typically in all three of those pillars, in teaching, in service, and in scholarship. Their involvement in each may vary, but typically for teaching, that is going to involve lecturing, creating active learning opportunities, maybe facilitating a lab course or another small group type course, and then course coordination and course development. So you're really involved in all of the different aspects of teaching. As far as service goes, full-time faculty members typically serve on committees, and those committees are the things that help keep the college running. So that may be a curriculum committee that will dive more into the curriculum development. It may be an admissions committee. We both serve on the admissions committee, so we are involved in helping to figure out interviews and application reviews and all of those things. And there are a laundry list of many, many committees that you can be involved in. Your service might also include advising, so serving as a faculty advisor to students, and then mentoring as well. Within colleges of pharmacy, there are typically different departments. So if you're a full-time faculty member, usually you will be within a specific department. Common departments within colleges of pharmacy are often the pharmacy practice department. So those are typically the faculty members that function in more of the clinical space of pharmacy. So they may also have practice sites where they are seeing patients at a clinic or in the hospital. There is often a social and administrative department. So that might include things like drug information or pharmacoeconomics or some of the other more social science areas within pharmacy. And then finally, typically there is usually a pharmaceutical sciences department. So they are going to cover topics like pharmaceutics or pharmacology or pharmacokinetics. I mentioned that the breakdown of responsibilities can really vary. We like to think of these areas as pieces of a pie, and each piece of the pie will look different for each faculty member. So if one faculty member may spend the majority of their time teaching, and then their service and scholarship responsibilities may be less, others may be really research focused. So that piece of their pie is very big. Maybe they do a little less teaching or a little less service. So you can really find a position that matches what your individual interests are. And then as a full-time faculty member, you may also have some administrative responsibilities. So that may be in the form of being like a director of a particular area, or maybe you'll go into being part of the dean's office. So an assistant dean or associate dean, or it could be the dean of the whole college.
So alternatively to full-time faculty, there's other areas where you could help out as well and get teaching experience. You could be a guest lecturer or a laboratory instructor. So this can be a one-off lecture or this can be multiple lectures on specific topics. Typically, it's focused on one specific area of teaching. So here at Jefferson, some examples of where we would get guest lectures to come in would be for maybe more specialized specialties within pharmacy, like oncology or infectious diseases. So there's always opportunities that you can find, and I recommend if you are interested in any type of academia pharmacy, just to as you're going through either your pharmacy career or even as a resident, to take opportunities to be a guest lecturer, just to get your feet wet and just to practice and prepare yourself if you do desire to pursue a career in academia pharmacy. I will say from my own experience, as a resident, I had opportunities to go back to my alma mater and do a couple guest lectures, which significantly helped me kind of develop my teaching style as I moved forward through my pharmacy career. And on top of it not being full time, right? You can, be in a specific course for a set amount of time. And it doesn't have to be something that's necessarily an entire semester or an entire year, which is nice as well if you're practicing full time. So another great aspect of academia, one of my favorites, is precepting. So essentially what this is teaching student pharmacists at your practice site. So my practice site is ambulatory care, so outpatient primary care essentially. And I have students 2 out of the 3 clinic days a week. And essentially how this works is we involve our students in our day-to-day responsibilities. And the progression along the way is very fulfilling in terms of seeing your students start on day one, not necessarily knowing what to expect from the clinic or what type of patient population or how to manage that patient population. But towards the end, you're starting to see your students really grow and implement the things that they've learned throughout the semester, as well as through their didactic path as well. So on top of that, your students are learning things in the classroom and they get to apply it in the clinic or the practice site, wherever it may be. You also get to design and implement activities at that site. So you get to take what they're learning in class or what they haven't quite learned in class yet, and you get to teach them how to apply it into an actual patient. In class, things tend to be a lot more black and white, but in the real world setting, things tend to be a little bit more gray. So we're able to take some of that information that's learned in class and apply it into the clinical setting as well. And throughout that time, student performance is assessed as well, which just helps give feedback to students so that they can grow in their clinical knowledge and just be able to ultimately grow towards graduation and being a clinical practitioner on their own. So it's a great way, to, even if you aren't, full-time in a full-time academia position, there's lots of opportunities. Colleges of Pharmacy will be happy to give you students to precept, and I highly recommend doing it just for both you and the students.
Next up, we wanted to talk to you a little bit about why we decided to go into academic pharmacy and really what we like about it. So I can say for myself that one of the things that really drew me to pursuing this path as a pharmacist is the variety. So I know that every day is different. The opportunities that are available always are changing. So one day I might be in the classroom most of the day. The next day I might be working on a lecture. The third day might be focused on getting ready for an event or going to a committee meeting and then working on a research project. So I love that every day has that variety and I really don't get bored. There have also been a lot of variety of opportunities as my career continues. So I have been a preceptor working in ambulatory care. I have been the director of our lab courses. I now am working primarily in admissions. So as my career has moved on, there have been a lot of new opportunities, and that has also helped to keep things interesting and fresh. As far as specifically teaching goes, I really love when I can teach something to a student and see that light bulb go off. So that moment when a student really finally understands something or it clicks, that is a really feel good moment. And I like that I can feel good about giving back to our profession in that way, that I am helping future generations of pharmacists. I know when I teach, I really focus on thinking about this group of students going out there and caring for my grandparents, my parents, my aunts and uncles, the members of my community, and all of the amazing things that they are going to be able to do, if we're able to, help them get there. So that has also been, for me, a very valuable part of being in academic pharmacy. Dr. Zook, what drew you to academic pharmacy?
So I definitely second everything that Dr. Bellotti said. Definitely every day being different. I'm the type of person as well that really enjoys a lot of variety on a day-to-day basis, and you definitely get that in academic world. But for me as well, I love seeing that students grasp concepts and just see that progression towards becoming a pharmacist at the end of their 4 years. I specifically love seeing it in the clinical setting. As Dr. Bellotti said, with those light bulb moments, seeing students at the beginning of the rotation and then at the end, where you're asking them, okay, what do you want to do with this patient? And you kind of see them apply everything that we've kind of built up towards the end of the rotation. So I love just seeing the students be able to just grow and apply what they've learned in the classroom, and especially seeing it be applied on rotation with me in the clinical setting. I definitely, on top of that, just think it is the best of both worlds in terms of if you decide to go into a pharmacy practice position. Not only do you get to teach students, do you get to see them grow throughout those years, but also you get to build your patient relationships as well, which is very important to me. I enjoy patient care, and being in the ambulatory care setting, I do get a lot of face-to-face with patients. So I enjoy that balance of just being able to both serve students as well as my patients. I mean, on top of that, I mean, there's a lot of professional development opportunities within different organizations that you really get to take full opportunity of. I do feel like even though I've been in the academic setting for almost a year now, I do feel like I've had plenty of opportunities to grow professionally, and I do feel like there's been a plethora of opportunities around me, specifically through the college or through professional organizations that have been just great to utilize. And then I think on top of that as well, just the mentorship aspect. I really enjoy just being able to mentor students and use my past either failures or successes in pharmacy school just to help them grow, and either not make the same mistakes as I've made or just help guide them in the right direction. I just find that very fulfilling and enjoyable. And then you end up building long-lasting relationships as well. I think it's such an underutilized part of your pharmacy career, is just building those relationships with faculty members. I definitely still keep in contact with a lot of faculty members that I had in school too. So I enjoy building those same relationships and giving back in the same way.
So we've already kind of established that every day is a little bit different, but Dr. Zook, can you tell us about what does a typical day look like for you? Maybe a day when you are also going to your practice site.
Yeah. So I'm at my practice site 3 half days per week. So I'm there Tuesday, Wednesdays, and Thursdays. So typically, what ends up happening is usually either I'm teaching in the morning or I'm using that time to prepare for any type of lectures that's coming up, committee meetings, or just getting, any type of other, things that need completed throughout the day, is usually how my mornings will look. And then in the afternoon, I usually start around 1. I start seeing patients around 1 p.m. That's when I would go to clinic, usually have students with me. Usually in general, my students will see 1 to 2 patients out of my list. So they'll do their full workups. We'll talk about each patient, help guide them in any way that they need to be guided in before their patient interactions. And then we'll go through the entire patient list throughout the day. Students usually will do some type of documentation towards the end, and then we'll just throughout the process as well, just talk about either questions that come up, or I'll give them some type of drug information question as well to look up. And then once the students leave, most of the rest of the time for me is either writing notes, just to catch up from just the rest of the clinic time. And then any time that I've left over after notes, it's usually responding to emails or catching up on anything that needs to be done for the next day. So that's typically, so it's rough just because every day is different. So meetings can be thrown in there as well. That's kind of just roughly what a clinic day would look like.
We'll talk to you next a little bit about how would you pursue a role in academic pharmacy once you are licensed as a pharmacist. So for a full-time faculty position, the qualifications are definitely going to vary depending on the specific position. So I mentioned those different departments, for example. So what a college might be looking for a pharmacy practice faculty member will be very different than what they would look for a pharmaceutical sciences faculty member, for example. So typically for a pharmacy practice faculty member, you're coming with some sort of specific clinical background, whether you are a hospital specialist or you work in ambulatory care, or you're a community pharmacist. So they might be looking for a very specific area of expertise for you to fill. And then for the pharmaceutics department, they would be looking often for those that have research experience in those pharmaceutical science areas. So for the clinical role specifically, they do often look for residency training. So that's something that you can complete after you graduate from pharmacy school to really enhance your clinical skills in specific areas. But the other things beyond that, are going to vary definitely depending on the specific position. For a guest lecturer or laboratory instructor, I think a great way to pursue that is really just reaching out to the local college of pharmacy in your area. There are, I think, 142 colleges and schools of pharmacy throughout the country, so there's probably one somewhere close to you. So for after graduation, you can talk to them about what kind of opportunities they have that would be a good match for your practice area. So for example, if you graduate from pharmacy school and you have gone into working in cardiology, for example, they may be looking for someone with expertise in high blood pressure or high cholesterol to come in and teach a lecture on those specific topics. So that would be a great way to partner. You can also look for, opportunities to come in and serve as a lab instructor, for example, and that may be something that you do a few hours a week, in addition to your other pharmacist role. You'll definitely want to consider the time commitment that would be required in relation to your other work responsibilities. If you're going to be working, full time in one area and then adding on some teaching, what would that balance look like for you? To become a preceptor, first and foremost, I would recommend speaking with the supervisor that you're working with at your full-time job and finding out if where you're working already has a relationship with a school of pharmacy. So if you're working at a hospital, there may be other pharmacists that are already taking students, and you can get connected and do that as well. If there is no relationship established, you can reach out to the school or college of pharmacy directly. And usually it's the director of experiential education that you would talk to, and you can explore what opportunities exist. But most schools and colleges of pharmacy are very eager to partner with pharmacists in their community, whether that is to come in to do some guest lecturing or to be a preceptor. So I'm sure if you reach out, they would be happy to connect with you down the road after pharmacy school when you're working as a licensed pharmacist.
And what are some ways that you can best prepare yourself to pursue a career in pharmacy academia? So I think just getting involved in terms of during pharmacy school or before pharmacy school, just get experience either being a teaching assistant or a tutor. Get some practice and figuring out what your teaching style might look like, and just getting practice explaining things to other students. Getting involved in research is a great way, especially during pharmacy school. Faculty members are always looking for students to partner with. So, reach out to faculty members and see what they have or what opportunities they have for research. Explore for opportunities to enhance your communication skills, either through professional organizations like AACP. Look for ways that you can help develop those communication skills, so that you can just continue to develop, your teaching style as well. During pharmacy school, I highly, highly recommend, if you have any interest in academia, is to complete an advanced pharmacy practice experience or an APPE, academia pharmacy rotation. So this is something that I did in school, and this is what really facilitated my desire to do academia. I think if I wouldn't have done it, I don't know I would be sitting here right now. So I highly recommend taking advantage of that, and that would be in your fourth year or your last year of pharmacy school. Also, exploring what the American Association of Colleges of Pharmacy has, like the Aspiring Academics program, or just other programs that they have as well, that could help guide you in that direction. And then after pharmacy school, there's teaching certificate programs that are available out there. In my instance, I was able to complete that through my residency program, and it was really helpful, just to help develop like a teaching philosophy, help figure out your lecture style, help write learning objectives, just different things that you wouldn't think about that you might need as you kind of walk towards that career path as well. And then always look for continuing education opportunities around teaching, being a preceptor, providing feedback, or being a mentor. It's just important, even if you don't go into full-time academia. If you do desire to preceptor, it's really good just to find some resources that help you to be the most effective preceptor, so that you can really serve your students.
Great. So I think we have just a couple minutes left if there are any questions. Thank you for being here too. And we hope we've given you some things to think about of maybe pursuing a career in academic pharmacy.
Thank you guys so much for that presentation. As a reminder, attendees can type in questions in the Q&A feature. We haven't received any so far. I'll give it a few more minutes in case people want to type in questions last minute. If anyone thinks of questions last minute, or after we wrap up today's session, you feel free to visit our speakers at their booth between 5 and 7 p.m. Eastern Time for expo hours. And thank you so much for your time and for this great presentation. Everyone else enjoy the rest of the virtual fair.
Thanks, everyone. We appreciate you being here.
Thank you, everyone.